Question 1. The assessment process reveals a claimant who struggles to articulate their symptoms clearly due to a diagnosed speech impediment and exhibits significant anxiety when questioned directly about their functional limitations. Which communication strategy best upholds the principles of fair and accurate disability evaluation under the CEDIR framework? Option A. Encouraging the claimant to speak faster and more directly to ensure the evaluation stays within the allotted time. Option B. Employing a variety of communication methods, including written questionnaires and allowing extended pauses for responses, while maintaining a calm and supportive demeanor. Option C. Proceeding with standard questioning techniques, assuming the claimant will eventually articulate their issues if they are significant enough. Option D. Focusing solely on observable physical manifestations of impairment, disregarding verbal explanations that are difficult to understand. Correct answer is B. Employing a variety of communication methods, including written questionnaires, and allowing extended pauses for responses, while maintaining a calm and supportive demeanor. Explanation. The assessment process reveals a claimant experiencing significant communication barriers due to a diagnosed speech impediment and a history of anxiety in social situations. This scenario is professionally challenging because the evaluator must ensure the claimant's disability and impairment rating accurately reflects their functional limitations without being unduly influenced by communication difficulties that are themselves a manifestation of the disability. The evaluator's communication approach directly impacts the quality and validity of the information gathered, which is foundational to a fair and accurate assessment under the Certification in Evaluation of Disability and Impairment Rating (CEDIR) framework. The correct approach represents best professional practice by prioritizing clear, empathetic, and adaptable communication strategies. This involves actively employing techniques that accommodate the claimant's speech impediment and anxiety, such as allowing extended response times, using visual aids, and creating a calm, non-judgmental environment. This aligns with CEDIR ethical guidelines and regulatory intent to ensure all claimants have a fair opportunity to present their case, regardless of communication challenges. It upholds the principle of a person-centered evaluation, where the individual's needs and circumstances are paramount in the assessment process. An incorrect approach that involves rushing the claimant or dismissing their communication difficulties as irrelevant would represent a significant regulatory and ethical failure. This would violate the CEDIR principle of thorough and objective evaluation, as it would lead to incomplete or inaccurate data collection. Furthermore, it could be construed as discriminatory, failing to provide reasonable accommodations for a disability-related communication impairment. Another incorrect approach, such as assuming the claimant is being evasive or uncooperative due to their communication style, would demonstrate a lack of professional judgment and empathy, potentially leading to an unfair rating and undermining the integrity of the evaluation process. Professionals should employ a decision-making framework that begins with identifying potential communication barriers early in the assessment. This should be followed by a proactive selection of communication strategies tailored to the individual claimant's needs, informed by an understanding of the relevant CEDIR regulations and ethical codes. Continuous assessment of the communication dynamic throughout the evaluation is crucial, with adjustments made as necessary to ensure understanding and accurate information exchange. The ultimate goal is to gather comprehensive and reliable information to support an objective and fair disability and impairment rating. Question 2. Examination of the data shows that an individual is seeking an evaluation for a chronic condition impacting their ability to perform daily tasks and their previous employment. The evaluator has access to the individual's medical records, including physician's notes and diagnostic test results, has conducted a physical examination, and has administered a standardized questionnaire regarding pain and functional limitations. The evaluator also observed the individual's gait and mobility during the appointment. Which combination of evaluation methods best supports a comprehensive and accurate assessment of disability and impairment rating according to best practice principles? Option A. Prioritizing the results of the standardized questionnaire over all other data. Option B. Integrating clinical assessments, questionnaires, and observational techniques to form a holistic view. Option C. Relying solely on the physician's notes and diagnostic test results from the medical records. Option D. Focusing primarily on the observations made during the physical examination regarding gait and mobility. The correct answer is B. Integrating clinical assessments, questionnaires, and observational techniques to form a holistic view. Explanation. This scenario presents a professional challenge because accurately evaluating disability and impairment requires a multifaceted approach that considers the individual's subjective experience, objective clinical findings, and functional limitations in their daily life and work. Relying on a single evaluation method can lead to an incomplete or inaccurate assessment, potentially resulting in an unfair or inappropriate disability rating. Careful judgment is required to synthesize information from various sources to form a comprehensive and evidence-based opinion. The correct approach represents best professional practice because it integrates multiple evaluation methods, aligning with the principles of comprehensive assessment, often mandated or recommended by regulatory bodies for disability and impairment evaluations. Clinical assessments provide objective medical findings. Questionnaires offer insights into the individual's self-reported symptoms and functional impact, and observational techniques can validate or contextualize reported limitations. This holistic approach ensures that the evaluation is grounded in both objective evidence and the individual's lived experience, leading to a more accurate and defensible rating. Adherence to these best practices is crucial for maintaining professional integrity and ensuring fair outcomes for individuals seeking disability or impairment evaluations. An incorrect approach that relies solely on clinical assessments fails to capture the subjective impact of the condition on the individual's daily functioning and work capacity. This overlooks a critical component of disability evaluation, potentially leading to an underestimation of impairment. Ethically, this can be seen as a failure to adequately consider the claimant's reported experience, which is a fundamental aspect of a thorough assessment. An incorrect approach that relies exclusively on questionnaires, while providing valuable subjective data, lacks the objective medical validation that clinical assessments offer. This can lead to an overestimation of impairment if subjective reports are not corroborated by objective findings, potentially resulting in an inaccurate and unsupported rating. Regulatory frameworks typically require objective medical evidence to support disability claims. An incorrect approach that focuses only on observational techniques without integrating clinical assessments or questionnaires provides a limited snapshot of the individual's condition. While observation can be useful for corroborating functional limitations, it does not provide the underlying medical diagnosis or the full spectrum of subjective experiences. This approach risks being superficial and failing to meet the comprehensive evidentiary standards required for disability evaluations. The professional decision-making process for similar situations should involve a systematic review of all available information. This includes understanding the specific regulatory requirements for the evaluation, identifying the strengths and limitations of each evaluation method, and critically synthesizing the data from all sources. Professionals must prioritize methods that provide objective evidence, capture subjective experience, and assess functional capacity in a relevant context. The goal is to build a robust and well-supported opinion that accurately reflects the individual's disability or impairment. Question 3. Performance analysis shows that a claimant presents with significant difficulties in recalling recent events and following multi-step instructions, alongside challenges in initiating and organizing tasks. The evaluator must determine the most appropriate method for assessing the overall impact of these cognitive deficits on the claimant's functional capacity for the purpose of an impairment rating under the CEDIR framework. Which of the following approaches best reflects a comprehensive and integrated evaluation of memory, attention, and executive function? Option A. Conducting a thorough evaluation of each cognitive domain, memory, attention, executive function, using appropriate standardized instruments and clinical observations, and then synthesizing these findings to determine the overall functional impairment. Option B. Prioritizing the assessment of memory recall through standardized tests, and then extrapolating the impact on attention and executive function based on these results. Option C. Focusing primarily on the claimant's self-reported difficulties with task initiation and organization, assuming these executive function deficits are the sole drivers of all cognitive impairments. Option D. Administering a single, broad cognitive screening tool that provides a general overview, but does not offer detailed subdomain analysis for memory, attention, or executive function. The correct answer is B. Prioritizing the assessment of memory recall through standardized tests, and then extrapolating the impact on attention and executive function based on these results. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the evaluator to synthesize information from multiple cognitive domains, memory, attention, executive function, to arrive at an impairment rating. The challenge lies in accurately translating subjective reports and objective tests, results into a quantifiable impairment that aligns with the specific regulatory framework of the Certification in Evaluation of Disability and Impairment Rating (CEDIR) exam. Misinterpreting or overemphasizing certain findings can lead to an inaccurate and potentially unfair rating, impacting the claimant's benefits and the integrity of the evaluation process. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive and integrated assessment of cognitive function. By considering how deficits in memory, attention, and executive function interact and impact an individual's overall functional capacity, the evaluator can arrive at a more accurate and defensible impairment rating. This aligns with the CEDIR likely emphasis on functional impact rather than isolated test scores. The regulatory framework for such evaluations typically requires a holistic view, ensuring that the rating reflects the claimant's real-world limitations. Incorrect approaches analysis. An approach that focuses solely on memory deficits, disregarding attention and executive function, is professionally unacceptable. This fails to acknowledge the interconnectedness of cognitive processes. For example, poor attention can significantly impair memory encoding and retrieval, making it appear as a primary memory deficit when it is secondary to attention issues. This selective focus violates the principle of comprehensive evaluation mandated by regulatory frameworks, which expect a thorough assessment of all relevant functional domains. An approach that overemphasizes executive function deficits without adequately considering their impact on memory and attention is also flawed. Executive functions are crucial for organizing, planning, and problem-solving, which in turn influence how effectively an individual can attend to tasks and recall information. Ignoring the interplay can lead to an inflated or misattributed impairment rating, deviating from the regulatory requirement for a balanced and integrated assessment. An approach that relies exclusively on subjective patient self-reports without objective cognitive testing is professionally unacceptable. While subjective reports are valuable, they are prone to bias and may not accurately reflect objective functional limitations. Regulatory frameworks for disability and impairment evaluations typically mandate objective assessment methods to ensure reliability and validity of the findings. This approach would fail to meet the evidentiary standards required for a credible impairment rating. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with understanding the specific requirements of the CEDIR regulatory framework. This involves identifying the key cognitive domains to be assessed and the expected methodologies. The evaluator should then gather all available data, including medical history, clinical observations, and results from standardized cognitive assessments. The next step is to analyze the interrelationships between deficits in memory, attention, and executive function, considering how these deficits collectively impact the individual's ability to perform daily activities and occupational tasks. Finally, the evaluator must translate this comprehensive understanding into an impairment rating that is consistent with the established guidelines and evidence, ensuring transparency and defensibility. Question 4. Market research demonstrates that evaluators preparing for the Certification in Evaluation of Disability and Impairment Rating (CEDIR) exam often face decisions regarding the most appropriate standardized assessment tools for evaluating functional impairment. Considering the CEDIR emphasis on a comprehensive and objective assessment of disability across various life domains, which of the following approaches best aligns with the likely expectations of the CEDIR regulatory framework when selecting a tool to measure an individual's functional limitations? Option A. Selecting the WHO Disability Assessment Schedule, WHODAS, due to its broad scope in measuring disability across 6 domains of functioning and its international recognition for capturing a wide range of health conditions and their impact on daily life. Option B. Prioritizing the Functional Independence Measure, FIM, exclusively, as it is a widely used tool in rehabilitation settings for measuring the level of assistance needed for specific activities of daily living. Option C. Utilizing a proprietary assessment tool developed by the evaluator's own organization, which has been found to be effective in their internal case management. Option D. opting for a highly specialized clinical assessment tool designed for a single, specific medical diagnosis, assuming it will provide the most detailed information about the impairment. The correct answer is A. Selecting the WHO Disability Assessment Schedule, WHODAS, due to its broad scope in measuring disability across 6 domains of functioning and its international recognition for capturing a wide range of health conditions and their impact on daily life. Explanation: this scenario is professionally challenging because it requires an evaluator to navigate the selection and application of standardized assessment tools within the specific regulatory framework of the Certification in Evaluation of Disability and Impairment Rating (CEDIR) exam. The core challenge lies in ensuring that the chosen tool aligns with the assessment objectives, the individual's condition, and the specific requirements of the CEDIR framework, which emphasizes a standardized and objective evaluation process. Careful judgment is required to avoid bias and ensure the validity and reliability of the assessment. The correct approach represents best professional practice because it prioritizes the use of a tool that is recognized and validated for its ability to capture a broad spectrum of functional limitations across various domains, as is the intent of the CEDIR. The WHO Disability Assessment Schedule, WHODAS, is designed for this purpose, providing a comprehensive measure of health and disability that is applicable across different cultures and conditions. Its alignment with international standards and its focus on functional impairment make it a suitable choice for an evaluation aiming for standardized and objective impairment ratings, as expected within the CEDIR framework. An incorrect approach would involve selecting a tool that is too narrow in scope or not validated for the specific purpose of impairment rating within the CEDIR context. For instance, relying solely on a tool designed for a very specific clinical condition without considering broader functional impact would be a failure. Another incorrect approach would be to use a tool that is not recognized or accepted by the regulatory body governing the CEDIR exam, leading to an assessment that does not meet the required standards. Ethically, using an inappropriate tool can lead to inaccurate ratings, potentially disadvantaging the individual being assessed and undermining the integrity of the evaluation process. It also fails to uphold the professional obligation to use evidence-based and appropriate assessment methodologies. The professional decision-making process for similar situations should involve a thorough understanding of the CEDIR-specific requirements and guidelines regarding assessment tools. This includes identifying the purpose of the evaluation, the nature of the impairment being assessed, and the accepted methodologies. Evaluators should consult the official CEDIR documentation and any recommended or mandated assessment tools. When multiple tools appear suitable, a comparative analysis of their psychometric properties, scope, and relevance to the CEDIR objectives is crucial. The decision should always be justifiable based on the evidence and the regulatory framework. Question 5. Analysis of a claimant's medical report reveals descriptions of osteoarthritic changes in the bilateral glenohumeral joints and rotator cuff tendinopathy affecting the supraspinatus tendon. Which of the following best demonstrates a professional approach to interpreting these terms for an impairment rating evaluation under the CEDIR framework? Option A. Seeking clarification from a qualified orthopedic specialist regarding the specific anatomical structures involved and the functional implications of these conditions. Option B. Assuming that bilateral implies equal severity and that tendinopathy always leads to significant functional loss. Option C. Relying on general knowledge of arthritis and tendon issues to infer the severity of the impairment. Option D. Focusing primarily on the claimant's reported pain levels, without delving into the precise anatomical and pathological details. The correct answer is A. Seeking clarification from a qualified orthopedic specialist regarding the specific anatomical structures involved and the functional implications of these conditions. Explanation: the scenario presents a professional challenge due to the inherent complexity of medical terminology and anatomical descriptions in disability and impairment evaluations. Accurately interpreting these terms is crucial for determining the extent of functional limitation and its impact on an individual's ability to work or perform daily activities. Misinterpretation can lead to incorrect assessments, potentially resulting in unfair denial of benefits or overestimation of disability, both of which have significant ethical and regulatory implications. The CEDIR framework emphasizes precision and adherence to established medical and vocational standards. The correct approach represents best professional practice because it prioritizes a thorough understanding of the specific medical terminology and anatomical structures involved. This ensures that the evaluation is grounded in objective medical evidence and accurately reflects the claimant's condition. Adherence to the CEDIR guidelines on evidence interpretation and the use of qualified medical professionals for clarification is paramount. This approach aligns with the regulatory requirement to conduct fair and accurate evaluations based on comprehensive and well-understood medical data. An incorrect approach that relies on assumptions or generalized knowledge of medical terms without seeking clarification from a qualified source fails to meet the professional standards of the CEDIR. This can lead to misinterpretations of the severity or nature of the impairment, violating the ethical obligation to conduct a thorough and unbiased assessment. Such an approach may also contravene specific regulatory requirements within the CEDIR framework that mandate the use of precise medical evidence and expert consultation when necessary. Another incorrect approach that focuses solely on the patient's subjective reporting of symptoms without correlating it with objective medical findings, even if the terminology is understood, is also professionally unacceptable. While subjective reporting is important, the CEDIR framework requires a balance with objective medical evidence to substantiate the claimed disability. Failure to integrate both aspects can lead to an incomplete or biased evaluation, potentially violating regulatory mandates for evidence-based assessments. The professional decision-making process for similar situations should involve a systematic approach. First, identify all medical terminology and anatomical references within the provided documentation. Second, if any terms are ambiguous, unfamiliar, or critical to the assessment, consult authoritative medical dictionaries, anatomical atlases, or, most importantly, seek clarification from the reporting physician or a specialist. Third, cross-reference the medical findings with the functional capacity assessment, ensuring that the anatomical and medical descriptions directly inform the evaluation of impairment. Finally, document all steps taken to ensure clarity and accuracy in the interpretation of medical information. Question 6. Operational review demonstrates an individual presence with a diagnosed degenerative physical condition affecting mobility, alongside a history of anxiety and reported difficulties with concentration and memory. The evaluation team is tasked with determining the overall impairment rating, which approach best aligns with the principles of comprehensive disability assessment. Option A. Prioritize the self-reported cognitive difficulties and anxiety, as these are often subjective and can significantly impact an individual's perceived ability to work, and assign a rating based on these factors. Option B. Conduct a detailed assessment of the physical mobility limitations and their direct impact on functional capacity, while also thoroughly evaluating the anxiety, concentration, and memory issues, and considering how these various impairments interact to affect the individual's overall functioning. Option C. Focus primarily on the objective findings related to the physical condition, as this is the most clearly defined impairment, and assign a rating based solely on its impact. Option D. Evaluate each disability type in isolation, assigning separate ratings for physical, mental, sensory, and cognitive impairments, and then averaging these scores to arrive at a final impairment rating. The correct answer is B. Conduct a detailed assessment of the physical mobility limitations and their direct impact on functional capacity, while also thoroughly evaluating the anxiety, concentration, and memory issues, and considering how these various impairments interact to affect the individual's overall functioning. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the evaluator to move beyond a superficial understanding of an individual's limitations and delve into the complex interplay of different disability types. Accurately assessing the impact of a physical impairment on cognitive function, or how a sensory deficit might exacerbate a mental health condition, demands a holistic and nuanced approach. Failure to do so can lead to an inaccurate impairment rating, potentially resulting in inadequate support or benefits for the individual, and non-compliance with regulatory requirements for comprehensive evaluation. Correct approach analysis. The correct approach involves a thorough, multifaceted assessment that considers the individual's reported symptoms, objective medical findings, and functional limitations across all relevant disability categories. This aligns with the principles of comprehensive disability evaluation, which mandates that evaluators consider the totality of an individual's impairments and their combined impact on their ability to function. This approach ensures that the evaluation is not siloed by disability type, but rather reflects the individual's lived experience and the synergistic effects of their conditions, leading to a more accurate and equitable impairment rating. Incorrect approaches analysis, an approach that focuses solely on the most apparent physical impairment, neglecting the potential impact of underlying mental health conditions or cognitive deficits, is professionally unacceptable. This failure constitutes a breach of the regulatory requirement for a comprehensive evaluation, as it overlooks significant contributing factors to the individual's overall functional capacity. Ethically, it is also problematic as it may lead to an underestimation of the individual's needs and a denial of appropriate support. An approach that prioritizes self-reported mental health symptoms without corroborating objective medical evidence or functional assessments, while disregarding observable physical limitations, is also professionally flawed. This can lead to an overemphasis on subjective complaints and an underestimation of the impact of physical conditions. Regulatory failure occurs when the evaluation does not adequately consider all documented impairments and their functional consequences. Ethically, it risks misrepresenting the individual's overall disability. An approach that exclusively considers sensory impairments and their direct impact, without exploring how these might interact with or be exacerbated by cognitive challenges or physical mobility issues, is incomplete. This siloed thinking fails to capture the full spectrum of functional limitations. It violates the spirit and letter of comprehensive evaluation guidelines, which expect evaluators to consider the interconnectedness of various impairments. Professional reasoning. Professionals should adopt a systematic and integrated approach. This involves 1. Thoroughly reviewing all available medical documentation, including reports from specialists in physical, mental, sensory, and cognitive domains. 2. Conducting a comprehensive interview that elicits information about the individual's experiences across all areas of potential impairment. 3. Performing or requesting appropriate functional assessments that measure the impact of each identified impairment on daily activities and work capacity. 4. Synthesizing all gathered information to understand the interrelationships between different types of disabilities and their cumulative effect. 5. Applying established impairment rating guidelines consistently and equitably, ensuring that the final rating reflects the totality of the individual's functional limitations. Question 7. Quality control measures reveal a trend where some certified evaluators are increasingly relying on remote consultations and automated digital questionnaires for initial disability assessments, citing efficiency gains. Considering the regulatory framework for the Certification in Evaluation of Disability and Impairment Rating (CEDIR), which approach best upholds the integrity and accuracy of impairment ratings. Option A. Transitioning entirely to telehealth and digital platforms for all aspects of disability assessment, including diagnosis, functional capacity evaluation, and impairment rating, to maximize efficiency and reduce overhead costs. Option B. Accepting digital reports and self-assessments submitted by individuals without requiring any direct interaction or independent clinical verification, as long as they are submitted through an approved digital portal. Option C. Utilizing automated digital questionnaires as the primary diagnostic tool, with evaluators only intervening for complex cases that cannot be resolved through the digital platform. Option D. Implementing a hybrid model where telehealth and digital tools are used to gather preliminary information and support direct in-person assessments, ensuring that all critical clinical observations and functional capacity evaluations are conducted face-to-face or through validated remote methods that replicate in-person standards. The correct answer is D. Implementing a hybrid model where telehealth and digital tools are used to gather preliminary information and support direct in-person assessments, ensuring that all critical clinical observations and functional capacity evaluations are conducted face-to-face or through validated remote methods that replicate in-person standards. Explanation. This scenario presents a professional challenge due to the evolving landscape of disability assessment and the integration of technology. The core difficulty lies in balancing the efficiency and accessibility offered by digital tools and telehealth with the fundamental requirement of accurate, reliable, and ethically sound disability evaluations, as mandated by the Certification in Evaluation of Disability and Impairment Rating (CEDIR) framework, ensuring that technology enhances, rather than compromises, the integrity of the assessment process is paramount. The correct approach represents best professional practice because it prioritizes adherence to established CEDIR guidelines regarding the evaluation of disability and impairment. This involves a critical assessment of how telehealth and digital tools can be integrated without undermining the core principles of direct observation, comprehensive history-taking, and objective clinical findings. It acknowledges that while technology can be a valuable adjunct, it must not replace essential components of a thorough assessment that ensure the validity and reliability of the impairment rating. This approach aligns with the ethical imperative to provide accurate and unbiased assessments that serve the best interests of the individual being evaluated and the integrity of the disability determination system. An incorrect approach that relies solely on digital tools without adequate validation or consideration of their limitations fails to meet CEDIR standards for comprehensive evaluation. This could lead to inaccurate impairment ratings, potentially resulting in inappropriate benefit decisions and undermining public trust in the disability assessment process. Ethically, it breaches the duty of care to conduct a thorough and accurate assessment. Another incorrect approach that indiscriminately adopts new technologies without a clear understanding of their impact on the assessment's validity and reliability risks introducing bias or overlooking crucial clinical indicators. This violates the principle of objectivity and fairness in evaluation. The professional decision-making process for similar situations should involve a systematic evaluation of any proposed technological integration. This includes 1. Understanding the specific CEDIR requirements for the type of assessment being conducted. 2. Critically assessing the capabilities and limitations of the technology in question. 3. Determining how the technology can be used to supplement, not supplant, essential assessment components. 4. Ensuring that the use of technology is documented thoroughly and transparently. And 5. Seeking ongoing professional development to stay abreast of best practices in technology-assisted disability evaluation. Question 8. Research into the ethical obligations of a certified evaluator reveals a situation where a client, seeking an impairment rating for a disability claim, expresses a strong desire for a specific rating outcome that appears to exceed the objective findings from the evaluator's assessment. The client is articulate about their perceived limitations and the impact on their life, but the clinical evidence and functional capacity assessments do not fully align with the requested rating. The evaluator is aware that a higher rating could significantly benefit the client financially and in terms of access to services. What is the most ethically and legally sound approach for the evaluator to take in this situation? Option A. Focus solely on the client's subjective report of their limitations, assigning the highest possible impairment rating based on their narrative, and omitting any detailed explanation of how this rating was derived from objective evidence. Option B. Clearly communicate the objective findings of the evaluation, explaining how the impairment rating was determined based on the applicable regulatory framework and evidence, while acknowledging the client's expressed concerns without altering the rating to meet their desired outcome. Option C. Decline to provide an impairment rating altogether, stating that the discrepancy between the client's expectations and the objective findings creates an unresolvable conflict. Option D. Adjust the impairment rating upwards to align with the client's desired outcome, explaining that the evaluation process is designed to be supportive and that a higher rating is justifiable given the client's subjective experience of their limitations. The correct answer is B. Clearly communicate the objective findings of the evaluation, explaining how the impairment rating was determined based on the applicable regulatory framework and evidence, while acknowledging the client's expressed concerns without altering the rating to meet their desired outcome. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a client's desire for a specific outcome and the evaluator's ethical and regulatory obligation to provide an objective and accurate assessment. The evaluator must navigate the pressure to please the client while upholding the integrity of the evaluation process, which is paramount in disability and impairment rating. The potential for misrepresentation or bias, even if unintentional, carries significant legal and ethical ramifications. Correct approach analysis. The correct approach involves clearly communicating the limitations of the evaluation and the objective findings, irrespective of the client's expectations. This aligns with the core principles of professional conduct in disability evaluation, emphasizing honesty, objectivity, and adherence to established rating guidelines. By documenting the rationale for the impairment rating based solely on the evidence and the applicable regulatory framework, the evaluator maintains professional integrity and avoids potential accusations of bias or undue influence. This approach ensures compliance with the legal and ethical standards governing the CEDIR certification, which mandate accurate and unbiased assessments. Incorrect approaches analysis. One incorrect approach involves agreeing to adjust the impairment rating to meet the client's desired outcome without sufficient objective justification. This constitutes a failure to adhere to the regulatory framework governing impairment ratings, which requires ratings to be based on established criteria and evidence. Ethically, this is a breach of objectivity and honesty, potentially leading to misrepresentation of the client's functional capacity and undermining the credibility of the evaluation process. Another incorrect approach is to ignore the client's stated desires and proceed with the evaluation without any attempt to understand their perspective or concerns. While objectivity is crucial, a complete disregard for the client's input can be perceived as unprofessional and may lead to a perception of an unfair or incomplete evaluation. Ethically, this can be seen as a lack of empathy and can erode trust, although it does not necessarily violate specific rating regulations if the final rating is objectively sound. However, best practice involves a balanced approach. A further incorrect approach is to overstate the impairment rating to appease the client, even if the objective evidence does not fully support such a rating. This is a direct violation of the regulatory framework, as it leads to an inaccurate and potentially fraudulent assessment. Ethically, this is a severe breach of integrity and honesty, exposing the evaluator to disciplinary action and legal consequences. Professional reasoning. Professionals in disability and impairment evaluation should adopt a decision-making process that prioritizes objectivity, evidence-based assessment, and adherence to regulatory guidelines. This involves 1. Thoroughly understanding the client's condition and functional limitations through comprehensive evaluation. 2. Clearly communicating the evaluation process and the criteria used for rating. 3. Documenting all findings and the rationale for the impairment rating meticulously. 4. Addressing client concerns respectfully while maintaining professional boundaries and objectivity. 5. Consulting relevant guidelines and regulations to ensure accurate application. 6. Being prepared to explain the rating determination based on objective evidence and regulatory requirements, even if it differs from the client's expectations. Question 9. The performance metrics show a consistent trend of evaluators in a particular state prioritizing the general principles outlined in the AMA guides over the specific directives provided in the state's own disability evaluation regulations when assessing certain musculoskeletal impairments. This practice is leading to an increase in appeals and a perception of inconsistency in ratings. As a senior evaluator tasked with improving compliance and consistency, what is the most appropriate approach to address this discrepancy? Option A. Advise evaluators to use their professional judgment to blend the AMA guides and state guidelines in a way they deem most equitable for each individual case, as long as the final rating appears reasonable. Option B. Encourage evaluators to continue prioritizing the AMA guides for their established medical rigor, and to only consult state guidelines when they are explicitly contradictory and cannot be reconciled with AMA principles. Option C. Recommend that evaluators disregard the AMA guides entirely for musculoskeletal impairments and develop their own subjective rating scales based on their experience, as long as they can justify the outcome. Option D. Emphasize to all evaluators that state-specific guidelines, when they exist and are applicable, must be followed precisely, even if they differ from the AMA guides, as these state regulations are the legally binding framework for disability determinations within the jurisdiction. The correct answer is D. Emphasize to all evaluators that state-specific guidelines, when they exist and are applicable, must be followed precisely, even if they differ from the AMA guides, as these state regulations are the legally binding framework for disability determinations within the jurisdiction. Explanation. Scenario analysis. This scenario presents a common challenge for disability evaluators, reconciling potentially conflicting guidance from a widely recognized standard, AMA guides, with specific, legally mandated state-specific guidelines. The professional challenge lies in ensuring compliance with the governing regulatory framework while also applying sound medical evidentiary principles. Failure to adhere strictly to the state's requirements can lead to legal challenges, appeals, and a loss of credibility for the evaluator and the system. The evaluator must demonstrate a nuanced understanding of when and how to deviate from general principles to meet specific legal obligations. Correct approach analysis. The correct approach prioritizes the state-specific guidelines because these are the legally binding regulations that govern disability evaluations within that jurisdiction. The AMA guides, while a valuable resource for establishing medical impairment, are often adopted or modified by state regulations. Therefore, when state guidelines explicitly address how to evaluate a particular condition or use a specific methodology, those state guidelines supersede the general recommendations of the AMA guides. This ensures consistency, fairness, and legal defensibility of the impairment rating. Adhering to the state-specific guidelines represents best professional practice by demonstrating a commitment to regulatory compliance and the legal framework governing disability assessments. Incorrect approaches analysis. An approach that solely relies on the AMA guides without considering state-specific modifications or mandates would be a regulatory failure. This is because state laws and regulations define the legal standard for disability determinations, and simply applying a general guide without incorporating these specific requirements would render the rating legally deficient and subject to challenge. It demonstrates a lack of understanding of the jurisdictional authority. An approach that attempts to blend the AMA guides and state guidelines arbitrarily, without a clear hierarchy or understanding of which takes precedence in specific circumstances, is also problematic. This can lead to inconsistent and unpredictable ratings, undermining the reliability and fairness of the evaluation process. It suggests an inability to navigate the interplay between general medical standards and specific legal mandates. An approach that dismisses the AMA guides entirely in favor of a subjective interpretation of state guidelines, without referencing the established medical principles they represent, could also be flawed. While state guidelines are paramount, they often build upon or adapt the AMA guides. A complete disregard for the underlying medical evidence and methodologies, even when adapting them to state requirements, could lead to ratings that are not medically sound, even if technically compliant with the letter of the law. Professional reasoning. Professionals must first identify the governing jurisdiction and its specific disability evaluation regulations. They should then consult the most current version of the AMA guides and any relevant state-specific modifications or supplementary guidelines. The decision-making process involves a hierarchical application. If state guidelines provide specific instructions for evaluating a condition or using a particular method, those instructions must be followed. If the state guidelines are silent on a specific aspect, then the AMA guides can be used as a default or supplementary resource, provided they are consistent with the overall intent and framework of the state regulations. Documentation must clearly articulate which guidelines were used and how they were applied, especially when state-specific deviations from the AMA guides are made. Question 10. The efficiency study reveals that a significant portion of disability evaluations are being completed with a primary focus on the diagnosis and severity of the medical condition, with limited consideration for the individual's environment and societal barriers. This approach, while expedient, is leading to a disconnect between the evaluated impairment and the individual's actual ability to engage in work and community life. An evaluator is tasked with assessing an individual with a chronic back condition. The medical reports clearly document the physical limitations. However, the individual reports significant challenges in accessing public transportation to attend appointments and a lack of accessible workspaces in their community, which are contributing to their inability to seek or maintain employment. Which approach best reflects a comprehensive and ethically sound evaluation process in this context? Option A. Focus on the individual's reported challenges with transportation and workplace accessibility, as these are the primary drivers of their inability to work. Option B. Streamline the evaluation by relying solely on the information provided in the medical reports to ensure consistency and speed. Option C. Integrate the medical findings with an assessment of environmental and societal barriers to understand the full impact of the impairment on the individual's functional capacity and participation. Option D. Prioritize the medical diagnosis and documented physical limitations, as these are the objective indicators of impairment. The correct answer is D. Prioritize the medical diagnosis and documented physical limitations, as these are the objective indicators of impairment. Explanation. This scenario is professionally challenging because it requires an evaluator to move beyond a purely clinical assessment of an individual's condition and consider the broader societal and environmental factors that contribute to their experience of disability. The core tension lies in reconciling the objective medical findings with the subjective lived experience and the impact of external barriers. Careful judgment is required to ensure that the evaluation accurately reflects the individual's functional limitations and their ability to participate in society, rather than solely focusing on the diagnosis or impairment. The correct approach represents best professional practice because it aligns with the principles of a rights-based and inclusive approach to disability, as increasingly reflected in modern regulatory frameworks and ethical guidelines for disability evaluation. This approach acknowledges that disability is not solely an individual's medical condition, but is also a result of the interaction between that condition and societal barriers. By considering the social model, the evaluator can provide a more holistic and accurate assessment of an individual's needs and the support required to enable their full participation. This is ethically sound as it promotes dignity, equality, and respect for the individual. Incorrect approaches fail to adequately address the multifaceted nature of disability, focusing solely on the medical model risks, overlooking the significant impact of environmental and attitudinal barriers, leading to an underestimation of an individual's functional limitations and their need for accommodations. This can result in unfair or inadequate support, violating ethical principles of fairness and equity. An approach that prioritizes administrative convenience over a thorough understanding of the individual's circumstances also represents a failure to uphold professional responsibility and ethical obligations to the individual being evaluated. Such an approach can lead to a depersonalization of the evaluation process, reducing the individual to a set of clinical data points rather than a person with a lived experience. The professional decision-making process for similar situations should involve a systematic approach that begins with a thorough understanding of the individual's medical condition and its objective limitations. This must then be integrated with an assessment of the environmental and social factors that either exacerbate or mitigate these limitations. Professionals should actively seek to understand the individual's perspective on their own disability and the barriers they face. This involves open communication, active listening, and a willingness to consider evidence beyond purely clinical reports. The evaluation should then articulate how these interacting factors contribute to the individual's overall functional capacity and their need for specific support or accommodations, ensuring that the assessment is both medically sound and socially relevant. Question 11. Which approach would be most appropriate for a CEDIR professional when evaluating a claimant's functional limitations, considering the need for objectivity and adherence to established assessment methodologies? Option A. Prioritizing the claimant's subjective feelings of pain and discomfort as the primary determinant of functional capacity, without extensive objective testing. Option B. Relying primarily on the claimant's detailed self-reported limitations and personal narrative to determine the extent of functional impairment. Option C. Utilizing a combination of standardized, validated assessment tools and techniques, cross-referencing findings with objective medical evidence and functional observations to form a comprehensive evaluation. Option D. Incorporating anecdotal evidence and opinions from family members or friends who have observed the claimant's daily activities to supplement the assessment. The correct answer is C. Utilizing a combination of standardized, validated assessment tools and techniques, cross-referencing findings with objective medical evidence and functional observations to form a comprehensive evaluation. Explanation. This scenario presents a professional challenge due to the inherent subjectivity in evaluating certain functional limitations and the potential for bias, both conscious and unconscious, to influence assessment outcomes. The CEDIR professional is tasked with providing an objective and evidence-based evaluation, which requires navigating situations where subjective interpretation is unavoidable. The core of the challenge lies in maintaining impartiality and ensuring the assessment accurately reflects the individual's functional capacity, rather than being swayed by external pressures or personal predispositions. Careful judgment is required to balance the need for thoroughness with the ethical imperative of fairness and accuracy. The correct approach represents best professional practice because it prioritizes the use of standardized, validated assessment tools and techniques that are recognized within the regulatory framework for evaluating disability and impairment. This adherence to established methodologies ensures consistency, reliability, and comparability of assessments. By cross-referencing findings from multiple sources, including objective medical evidence and functional assessments, the professional builds a robust and defensible evaluation. This systematic and evidence-based approach aligns with the CEDIR mandate to provide objective ratings and minimizes the risk of arbitrary or biased conclusions. It upholds the ethical principles of integrity and competence by relying on established professional standards. An incorrect approach that relies solely on the claimant's self-reported limitations without objective corroboration fails to meet the regulatory requirement for evidence-based evaluation. This approach is ethically flawed as it risks overestimating or underestimating the actual functional impairment, potentially leading to an inaccurate rating. It bypasses the professional's responsibility to conduct a comprehensive assessment that includes objective measures. Another incorrect approach that prioritizes anecdotal evidence or opinions from non-qualified individuals over standardized assessment tools is also professionally unacceptable. This deviates from the established regulatory framework and introduces an unacceptable level of subjectivity and potential bias. Such an approach undermines the credibility of the assessment and the professional's adherence to professional standards. It fails to demonstrate due diligence in employing appropriate assessment methodologies. The professional decision-making process for similar situations should involve a systematic review of the individual's medical history and current condition, followed by the selection and application of appropriate, validated assessment tools and techniques as mandated by the CEDIR framework. This includes gathering objective evidence, conducting functional assessments, and critically evaluating all information to arrive at an impartial and evidence-based impairment rating. Professionals must remain vigilant against potential biases and ensure their evaluations are grounded in established methodologies and regulatory requirements. Question 12. The review process indicates that a claimant has been diagnosed with degenerative disc disease affecting the lumbar spine, specifically at L4-L5 and L5-S1. The evaluation needs to determine the functional impact of this condition on the claimant's ability to perform work-related activities. Which of the following approaches most accurately reflects the necessary considerations for this assessment? Option A. Assess the claimant's reported pain levels and limitations in daily activities, correlating these with the general understanding of how degenerative disc disease affects spinal mobility. Option B. Evaluate the specific anatomical structures affected by the degenerative disc disease, e.g., intervertebral discs, facet joints, nerve roots at L4-L5 and L5-S1, and their known biomechanical functions to determine the potential impact on spinal stability, mobility, and neurological function relevant to work capacity. Option C. Consider the claimant's vocational history and the general physical demands of their previous occupations, assuming that degenerative disc disease in the lumbar spine would universally preclude them from such work. Option D. Focus on the claimant's ability to perform a range of motion exercises as demonstrated in physical therapy, without specific consideration for the anatomical structures identified as degenerated. The correct answer is A. Assess the claimant's reported pain levels and limitations in daily activities, correlating these with the general understanding of how degenerative disc disease affects spinal mobility. Explanation. The review process indicates a need to assess the impact of a claimant's diagnosed degenerative disc disease on their functional capacity. This scenario is professionally challenging because accurately translating anatomical findings into a meaningful assessment of disability requires a nuanced understanding of how specific spinal structures contribute to mobility, pain, and daily activities. It demands more than simply identifying the affected anatomical region. It requires understanding the biomechanical implications and potential functional limitations arising from the pathology. The correct approach represents best professional practice because it directly links the claimant's diagnosed anatomical impairment, degenerative disc disease affecting specific spinal segments, to observable functional deficits and their impact on the claimant's ability to perform work-related activities. This aligns with the core principles of disability evaluation, which aim to assess the extent to which a medical condition limits an individual's capacity to engage in substantial gainful activity. By considering the specific anatomical structures involved, e.g., intervertebral discs, facet joints, nerve roots, and their known biomechanical functions, the evaluator can make a more precise and defensible determination of impairment. This approach is supported by the regulatory framework for disability evaluation, which mandates a thorough assessment of medical conditions and their functional consequences. An incorrect approach would be to solely focus on the diagnostic label of degenerative disc disease, without considering the specific anatomical location and severity of the degeneration, or its direct impact on nerve function or spinal stability. This fails to provide the necessary detail for a robust evaluation and could lead to an inaccurate assessment of functional limitations. Another incorrect approach would be to rely on subjective reports of pain without correlating them to objective anatomical findings and their known functional consequences. While pain is a significant symptom, its evaluation in disability assessment must be grounded in the underlying pathology. A further incorrect approach would be to generalize the impact of degenerative disc disease across all individuals, ignoring the unique anatomical presentation and functional capacity of the specific claimant. This violates the principle of individualized assessment. The professional decision-making process for similar situations should involve a systematic approach. 1. Thorough review of all medical evidence, focusing on diagnostic imaging and physician reports that detail the specific anatomical structures affected by the degenerative disc disease. 2. Understanding the biomechanical role of the affected spinal segments and associated structures, e.g., discs, vertebrae, ligaments, nerve roots. 3. Correlating the anatomical findings with reported symptoms and observed functional limitations, considering how the degeneration might impact mobility, strength, endurance, and the ability to maintain postures or perform specific movements required for work. 4. Consulting relevant anatomical and biomechanical resources to understand the typical functional consequences of the identified pathology. 5. Formulating an assessment that clearly articulates the link between the anatomical impairment and the resulting functional limitations, supported by objective medical evidence. Question 13. The analysis reveals that a claimant's medical report frequently uses the term neuropathy in the context of evaluating disability and impairment ratings under the CEDIR framework. Which of the following best describes the most appropriate understanding and application of this medical term for accurate assessment? Option A. Neuropathy refers to a broad category of conditions affecting the peripheral nervous system, requiring specific diagnostic details and assessment of functional deficits to determine the degree of impairment. Option B. Neuropathy is primarily a subjective experience of pain and discomfort, and its impact on disability is best gauged by the claimant's self-reported level of distress. Option C. Neuropathy is a general term for nerve damage that, without further specification, can be assumed to cause a moderate level of functional impairment. Option D. Neuropathy is a condition that typically resolves on its own with rest, and therefore, its long-term impact on disability is usually minimal. The correct answer is C. Neuropathy is a general term for nerve damage that, without further specification, can be assumed to cause a moderate level of functional impairment. Explanation. The analysis reveals a scenario where an evaluator must interpret medical terminology to accurately assess an individual's disability and impairment rating. This is professionally challenging because the precise meaning of medical terms directly impacts the objective evaluation and subsequent rating, which in turn affects the individual's access to benefits or services. Misinterpretation can lead to inaccurate assessments, potentially causing significant financial and personal hardship for the claimant, and exposing the evaluator to professional sanctions. The correct approach involves a thorough understanding of the specific medical terms used in the claimant's documentation, cross-referencing them with established medical dictionaries, diagnostic manuals, such as the DSM or ICD, as applicable within the CEDIR framework, and any relevant guidelines provided by the regulatory body overseeing the CEDIR certification. This ensures that the evaluator is applying the most current and accurate definitions, leading to a defensible and objective impairment rating. This aligns with the ethical obligation to conduct evaluations with competence and integrity, and the regulatory requirement to adhere to established standards for disability assessment. An incorrect approach would be to rely on colloquial or generalized understandings of medical terms without consulting authoritative sources. For instance, assuming chronic pain is a universally defined term without considering its specific diagnostic criteria or impact on functional capacity as outlined in relevant guidelines would be a failure. Similarly, equating a diagnosis with a specific impairment rating without understanding the nuances of how that diagnosis translates to functional limitations according to the CEDIR framework would be erroneous. These approaches fail to meet the professional standard of due diligence and can lead to arbitrary or biased ratings, violating the principles of fairness and accuracy mandated by the regulatory framework. Professionals should approach such situations by prioritizing clarity and precision. This involves a systematic process. First, identifying all medical terms that require interpretation. Second, consulting authoritative medical and diagnostic resources relevant to the CEDIR framework. Third, understanding how these terms relate to functional limitations and the specific criteria for impairment rating. And finally, documenting the sources and reasoning used for each interpretation to ensure transparency and auditability. Question 14. The control framework reveals that when evaluating an individual with chronic obstructive pulmonary disease, COPD, for disability and impairment rating under the CEDIR framework, which of the following approaches best reflects the required understanding of pathophysiology for accurate assessment? Option A. Primarily considering the patient's reported shortness of breath during daily activities. Option B. Focusing on the progressive nature of airway inflammation and alveolar destruction and how these directly impact gas exchange and respiratory muscle function. Option C. Relying on the physician's general impression of the patient's overall health status without detailing specific pathophysiological mechanisms. Option D. Emphasizing the number of exacerbations the patient has experienced in the past year. The correct answer is B. Focusing on the progressive nature of airway inflammation and alveolar destruction, and how these directly impact gas exchange and respiratory muscle function. Explanation. The control framework reveals that accurately assessing disability and impairment ratings requires a thorough understanding of the underlying pathophysiology of common conditions. This scenario is professionally challenging because the evaluator must bridge the gap between medical science and regulatory requirements, ensuring that the assessment is both medically sound and compliant with the specific standards of the certification in evaluation of disability and impairment rating. CEDIR framework. A failure to grasp the pathophysiology can lead to misinterpretations of functional limitations and an inaccurate rating, potentially causing financial hardship for the claimant or misallocation of resources. The correct approach represents best professional practice because it directly aligns with the core competency expected of a CEDIR-certified professional: the ability to translate medical knowledge into objective impairment ratings. By focusing on the specific pathophysiological mechanisms of a condition, the evaluator can identify the direct impact on bodily functions and structures, which is the foundation for determining impairment. This approach ensures that the rating is evidence-based, objective, and defensible under the CEDIR framework, which emphasizes a scientific and systematic evaluation process. Adherence to the specific regulatory guidelines for the CEDIR exam is paramount, ensuring that the assessment methodology is consistent with established professional standards. An incorrect approach that relies solely on symptom reporting without understanding the underlying pathophysiology is professionally unacceptable. This failure constitutes a regulatory violation because it deviates from the CEDIR requirement for objective evaluation based on established medical principles and impairment guidelines. Ethically, it is a failure to conduct a thorough and accurate assessment, potentially leading to an unjust outcome for the claimant. Another incorrect approach that focuses on the duration of symptoms rather than their pathophysiological basis is also professionally unacceptable. This is a regulatory failure as it prioritizes a temporal aspect over the objective medical evidence of functional loss. Ethically, it can lead to an arbitrary rating that does not reflect the actual level of impairment. A third incorrect approach that prioritizes the claimant's perceived ability to work over the objective medical findings and their pathophysiological underpinnings is a significant regulatory and ethical breach. The CEDIR framework mandates an objective assessment of impairment, not a vocational assessment or a subjective interpretation of work capacity. This approach fails to adhere to the established criteria for impairment rating and can result in an inaccurate and unfair assessment. The professional decision-making process for similar situations should involve a systematic review of the claimant's medical records, focusing on diagnostic findings and the established pathophysiology of their condition. The evaluator must then cross-reference this medical understanding with the specific impairment rating guidelines mandated by the CEDIR framework. This involves identifying how the pathophysiological changes translate into functional deficits as defined by the regulations. If there is ambiguity, seeking clarification from medical experts or consulting relevant literature that links pathophysiology to functional impairment is crucial. The final rating must be a direct consequence of this objective, evidence-based process, ensuring compliance with both medical science and regulatory requirements. Question 15. The risk matrix shows a potential for significant bias in disability assessments when cultural factors are not adequately considered. An assessor is evaluating an individual from a cultural background where stoicism regarding pain and physical limitations is highly valued. The individual presents with symptoms that, in a different cultural context, might be more readily articulated and demonstrated. Which of the following approaches best aligns with the regulatory framework for the certification in evaluation of disability and impairment rating, CEDIR, in this scenario? Option A. The assessor proceeds with a standard functional assessment, assuming the individual's presentation accurately reflects their level of impairment without further cultural inquiry. Option B. The assessor focuses exclusively on objective medical findings, disregarding any subjective reports of pain or functional limitations that are not overtly demonstrated due to cultural expression norms. Option C. The assessor interprets the individual's reserved presentation as indicative of minimal impairment, as this aligns with a common cultural stereotype of resilience. Option D. The assessor actively probes for functional limitations and pain experiences, using open-ended questions and observing nonverbal cues, while acknowledging and respecting the individual's cultural norms regarding the expression of distress. The correct answer is D. The assessor actively probes for functional limitations and pain experiences, using open-ended questions and observing nonverbal cues, while acknowledging and respecting the individual's cultural norms regarding the expression of distress. Explanation. This scenario is professionally challenging because it requires the assessor to navigate potential biases and ensure a fair and accurate evaluation of disability and impairment within a specific cultural context. The assessor must go beyond a purely clinical or functional assessment to understand how an individual's cultural background might influence their perception of disability, their willingness to disclose symptoms, and their engagement with the assessment process. This requires sensitivity, cultural humility, and a commitment to equitable practice, all of which are implicitly or explicitly supported by the principles guiding professional disability evaluation. The correct approach represents best professional practice because it prioritizes a comprehensive and culturally sensitive assessment. By actively seeking to understand the individual's cultural background and its potential impact on their reported symptoms and functional limitations, the assessor demonstrates a commitment to a holistic and person-centered evaluation. This aligns with the ethical imperative to avoid bias and ensure that the assessment accurately reflects the individual's lived experience of disability, rather than imposing external cultural norms. Adhering to the specific regulatory framework for the certification in evaluation of disability and impairment rating, CEDIR, would mandate such a nuanced approach to ensure the integrity and validity of the impairment rating. An incorrect approach that relies solely on standardized questionnaires without considering cultural nuances fails to acknowledge the diversity of human experience and can lead to misinterpretations of disability. This can result in an inaccurate impairment rating, potentially disadvantaging the individual. Ethically, this approach breaches the principle of fairness and equity. Another incorrect approach, which dismisses cultural factors as irrelevant, demonstrates a lack of cultural competence and can alienate the individual, hindering the assessment process and leading to an incomplete or biased evaluation. This violates the professional duty to conduct a thorough and objective assessment. The professional decision-making process for similar situations should involve a proactive commitment to cultural awareness. Assessors should be trained in cultural competency, actively inquire about the individual's cultural background and its relevance to their disability, and be prepared to adapt assessment methods where appropriate, always within the bounds of the regulatory framework. This involves active listening, open-ended questioning, and a willingness to learn from the individual about their unique experiences. The ultimate goal is to achieve an accurate and fair assessment that respects the individual's cultural identity. Question 16. During the evaluation of a claimant seeking benefits under a disability program, the assessor reviews medical reports detailing a diagnosed degenerative joint disease in the claimant's knees. The reports clearly indicate significant pain and reduced range of motion. The assessor must determine if this condition constitutes a disability according to the program's guidelines. Which of the following approaches best aligns with the principles of evaluating disability and impairment within a regulatory framework? Option A. Conclude that any diagnosed medical condition causing pain is automatically considered a disability, regardless of its impact on the claimant's ability to perform substantial gainful activity. Option B. Assess the claimant's ability to perform work-related activities and daily tasks, considering how the diagnosed degenerative joint disease and its associated pain functionally limit these abilities, in conjunction with the specific legal definition of disability. Option C. Focus solely on the objective medical findings of joint degeneration, disregarding the claimant's subjective reports of pain and any resulting functional limitations. Option D. Determine disability based on the presence of a diagnosed medical condition and the reported pain, without further assessment of functional capacity. The correct answer is D. Determine disability based on the presence of a diagnosed medical condition and the reported pain, without further assessment of functional capacity. Explanation. This scenario is professionally challenging because it requires the evaluator to distinguish between a medical condition that causes functional limitations and the broader concept of disability as defined by relevant legislation. The evaluator must apply the specific legal definition of disability, which often goes beyond mere medical diagnosis, to consider the impact of the impairment on an individual's ability to perform daily activities or engage in substantial gainful activity. Misinterpreting these definitions can lead to incorrect assessments, impacting an individual's access to benefits or services. The correct approach represents best professional practice because it adheres strictly to the legal and regulatory framework governing disability evaluations. This involves a thorough understanding of how an impairment, a deviation from normal bodily function, translates into a disability, which is a more encompassing concept defined by its impact on an individual's capacity to function in society or the workplace. By focusing on the functional limitations and their impact on the individual's ability to perform work-related activities, the evaluator is applying the criteria mandated by the relevant legislation, ensuring fairness and accuracy in the assessment. This aligns with the ethical obligation to conduct evaluations based on established legal standards rather than solely on medical findings. An incorrect approach that focuses solely on the presence of a diagnosed medical condition without considering its functional impact fails to meet the legal definition of disability. This is a regulatory failure because it ignores the statutory requirements that necessitate an assessment of functional limitations. Ethically, it is a failure to conduct a comprehensive evaluation as required by professional standards. Another incorrect approach that equates impairment with disability without assessing the degree of functional limitation also represents a regulatory failure. Law typically requires a specific level of functional limitation to qualify as a disability, and simply having an impairment does not automatically meet this threshold. This approach risks over- or underclassifying individuals, leading to inequitable outcomes. The professional decision-making process for similar situations should involve a systematic review of the individual's medical evidence, a detailed assessment of their functional capacities across various domains, e.g., physical, mental, sensory, and a careful application of the specific legal definitions and criteria for disability as outlined in the governing regulations. This process requires critical thinking to bridge the gap between medical findings and legal definitions, ensuring that the evaluation is both medically sound and legally compliant. Question 17. The evaluation methodology shows a situation where an evaluator is assessing an individual for potential impairment ratings under the Americans with Disabilities Act (ADA). The individual's employer has expressed concerns about the potential cost and disruption of implementing reasonable accommodations, and has subtly suggested that a lower impairment rating would be beneficial for business operations. The evaluator is aware of the employer's concerns, but also has a professional obligation to accurately assess the individual's functional limitations. What is the most ethically and legally sound approach for the evaluator in this situation? Option A. Conduct a thorough and objective evaluation based solely on the individual's medical condition, functional limitations, and established impairment rating guidelines, without regard to the employer's financial concerns or suggestions. Option B. Inform the employer that their concerns about cost and disruption are irrelevant to the evaluation process and refuse to consider any information related to business operations. Option C. Prioritize the employer's stated concerns about business operations and financial impact by leaning towards a lower impairment rating, even if it means downplaying some of the individual's reported limitations. Option D. Focus on the potential for the individual to adapt and overcome their limitations with minimal accommodation, thereby justifying a lower impairment rating to alleviate the employer's concerns. The correct answer is A. Conduct a thorough and objective evaluation based solely on the individual's medical condition, functional limitations, and established impairment rating guidelines, without regard to the employer's financial concerns or suggestions. Explanation. The evaluation methodology shows a scenario where an evaluator must balance the legal requirements of the Americans with Disabilities Act (ADA) with the ethical imperative of providing an accurate and unbiased assessment. The professional challenge lies in navigating potential conflicts of interest and ensuring that the evaluation is not unduly influenced by external pressures or personal biases, which could compromise the integrity of the disability and impairment rating. The correct approach represents best professional practice because it prioritizes adherence to the ADA principles of non-discrimination and reasonable accommodation, while also upholding the evaluator's duty to conduct an objective assessment based on established medical and functional criteria. This approach ensures that the individual's rights are protected and that the rating accurately reflects their functional limitations, as mandated by the ADA and relevant professional standards. An incorrect approach that focuses solely on the employer's perceived needs or pressures to minimize accommodations would be a regulatory and ethical failure. This would violate the ADA prohibition against discrimination and the evaluator's professional obligation to provide an impartial assessment. Similarly, an approach that exaggerates limitations to secure a more favorable outcome for the individual without objective justification would also be a failure, undermining the credibility of the evaluation and potentially leading to inappropriate resource allocation. The professional decision-making process for similar situations should involve a clear understanding of the ADA provisions, including the definition of disability, the interactive process, and the concept of reasonable accommodation. Evaluators must critically assess all available information, apply objective evaluation criteria, and document their findings thoroughly. When faced with conflicting pressures, professionals should rely on their training, ethical guidelines, and the specific legal framework to make decisions that are both legally compliant and ethically sound, prioritizing accuracy and fairness above all else. Question 18. The risk matrix shows a potential for significant delays in processing disability claims due to the use of assessment tools with questionable psychometric properties. As a CEDIR certified evaluator, you are tasked with selecting the most appropriate assessment instruments for a cohort of individuals presenting with complex chronic pain conditions. You have identified several potential tools, each with varying levels of documented reliability, validity, and sensitivity. Which approach best aligns with the regulatory framework and ethical standards for the certification in evaluation of disability and impairment rating, CEDIR? Option A. Prioritize assessment tools that are widely recognized and have been used by colleagues for many years, assuming their established use implies adequate psychometric properties. Option B. Utilize a single, comprehensive assessment tool that covers a broad range of potential impairments, even if its specific psychometric data for chronic pain is less robust than other specialized tools. Option C. Conduct a thorough review of the peer-reviewed literature and psychometric validation studies for each potential assessment tool, selecting those with the strongest evidence of reliability, validity, and sensitivity relevant to chronic pain conditions. Option D. Select assessment tools based on their ease of administration and scoring, as this will expedite the evaluation process and reduce the backlog. The correct answer is A. Prioritize assessment tools that are widely recognized and have been used by colleagues for many years, assuming their established use implies adequate psychometric properties. Explanation. This scenario presents a professional challenge because it requires the evaluator to balance the need for efficient assessment with the ethical and regulatory imperative to use tools that accurately and consistently measure disability and impairment. The evaluator must critically assess the psychometric properties of the chosen assessment tools, specifically their reliability, validity, and sensitivity, to ensure that the resulting ratings are defensible and fair. Failure to do so can lead to inaccurate assessments, potentially impacting an individual's access to benefits or services, and exposing the evaluator to professional and regulatory sanctions. The correct approach involves a thorough review of the psychometric data for the assessment tools being considered. This means understanding the evidence supporting the reliability, consistency of measurement, validity, accuracy of measurement, and sensitivity, ability to detect change or differences of each tool within the specific context of the evaluation. Selecting tools with robust psychometric properties, supported by peer-reviewed research, and aligned with the CEDIR framework's expectations for evidence-based practice, is paramount. This ensures that the evaluation is conducted using methods that are scientifically sound, ethically responsible, and compliant with the standards expected for disability and impairment ratings. An incorrect approach would be to prioritize speed or ease of use over the psychometric integrity of the assessment tools. For instance, selecting a tool solely because it is widely used or readily available, without verifying its reliability, validity, and sensitivity for the specific population and condition being assessed, is a significant ethical and regulatory failure. This could lead to biased or inaccurate ratings, violating the principle of providing a fair and objective evaluation. Another incorrect approach would be to rely on anecdotal evidence or personal experience with a tool rather than objective psychometric data. This bypasses the rigorous standards required for professional evaluations and can result in inconsistent and unreliable assessments, contravening the CEDIR emphasis on evidence-based practice. Professionals should employ a decision-making process that begins with identifying the specific disability or impairment to be evaluated. Subsequently, they should research and identify assessment tools that are recognized for their psychometric soundness in measuring such conditions. This research should involve consulting professional literature, guidelines, and potentially seeking expert advice. The evaluator must then critically appraise the available psychometric data for each potential tool, focusing on reliability, validity, and sensitivity. The chosen tool, must not only be psychometrically sound, but also appropriate for the individual being assessed and the purpose of the evaluation. This systematic, evidence-based approach ensures that the evaluation is conducted with the highest degree of professional integrity and regulatory compliance. Question 19. Regulatory review indicates that an individual claimant presents with chronic pain and significant functional limitations, affecting their ability to perform daily activities and work. The claimant's treating physician has provided extensive documentation detailing the subjective experience of pain and its impact. When evaluating this claimant for disability benefits under a system that mandates the use of a specific, established impairment rating schedule, which approach best aligns with regulatory requirements and professional ethics. Option A. Assign an impairment rating based primarily on the claimant's reported pain levels and the subjective descriptions of functional limitations provided by the treating physician, without strict adherence to the specific objective criteria outlined in the mandated impairment rating schedule. Option B. Apply the impairment rating system by focusing on objective clinical findings and functional limitations that can be directly correlated to the specific criteria and definitions within the mandated schedule, documenting the rationale for how these findings translate into an impairment rating. Option C. Utilize a combination of criteria from the mandated impairment rating schedule and other, non-mandated disability evaluation guidelines, selecting those that appear to best represent the claimant's overall condition. Option D. Expedite the rating process by relying on a general understanding of disability and impairment, without a detailed, systematic application of the specific criteria within the mandated impairment rating schedule. The correct answer is B. Apply the impairment rating system by focusing on objective clinical findings and functional limitations that can be directly correlated to the specific criteria and definitions within the mandated schedule, documenting the rationale for how these findings translate into an impairment rating. Explanation. This scenario presents a professional challenge due to the inherent conflict between applying a standardized impairment rating system and the unique clinical presentation of an individual. The core difficulty lies in ensuring that the chosen impairment rating system, while aiming for objectivity and consistency, accurately reflects the functional limitations of the claimant without oversimplifying or misrepresenting their condition. The professional must navigate the ethical imperative to provide a fair and accurate assessment, which is paramount in both workers' compensation and Social Security disability contexts, as these ratings directly impact an individual's livelihood and access to benefits. The correct approach represents best professional practice because it prioritizes the claimant's functional capacity as understood through the lens of the applicable impairment rating system, while acknowledging the need for clinical judgment to interpret and apply the system appropriately. This involves a thorough understanding of the chosen system's guidelines, its intended scope, and its limitations. It also necessitates a commitment to documenting the rationale for the rating clearly and comprehensively, demonstrating how the claimant's condition translates into specific impairment percentages or functional limitations as defined by the system. This adherence to established protocols ensures fairness, transparency, and defensibility of the assessment. An incorrect approach that solely relies on a subjective interpretation of the claimant's pain without correlating it to objective functional deficits as defined by the chosen impairment rating system fails to adhere to the established regulatory framework. This can lead to an inaccurate rating that does not reflect the claimant's actual level of impairment according to the system's criteria, potentially resulting in an unfair denial or overestimation of benefits. Another incorrect approach might involve selectively applying criteria from different impairment rating systems without explicit justification or regulatory allowance. This violates the principle of consistent application of a single, proved system and undermines the integrity of the evaluation process. Furthermore, an approach that prioritizes expediency over thoroughness, leading to a superficial assessment, is ethically and regulatorily unsound, as it fails to meet the professional obligation to conduct a comprehensive and accurate evaluation. The professional decision-making process for similar situations should involve a systematic approach. First, clearly identify the applicable regulatory framework and the specific impairment rating system mandated for the context, e.g., workers' compensation or Social Security disability. Second, conduct a comprehensive clinical evaluation, gathering all relevant medical history, diagnostic findings, and functional assessments. Third, meticulously apply the chosen impairment rating system's guidelines, ensuring each criterion is considered and documented. Fourth, critically analyze how the claimant's condition maps onto the system's definitions of impairment, using clinical judgment to interpret ambiguous findings within the system's parameters. Finally, clearly articulate the rationale for the final rating, referencing specific sections of the impairment rating system and supporting clinical evidence to ensure transparency and accountability. Question 20. Market research demonstrates that individuals undergoing disability evaluations often have concerns about the privacy of their personal health information. In a situation where an evaluator believes that information from a previous, unrelated medical provider would significantly enhance the accuracy of the current disability assessment, but the individual has not explicitly authorized this specific disclosure, what is the most appropriate course of action according to the CEDIR regulatory framework? Option A. Assume that by participating in the evaluation, the individual has implicitly consented to the release of any information deemed necessary by the evaluator. Option B. Proceed with contacting the previous medical provider to obtain the relevant information, as it is deemed essential for a comprehensive evaluation. Option C. Contact the previous medical provider and request the information, informing them that it is for a disability evaluation and that the individual is aware of the request. Option D. Explain to the individual the importance of the information from the previous provider for the evaluation and request their explicit, written consent for its disclosure. The correct answer is B. Proceed with contacting the previous medical provider to obtain the relevant information, as it is deemed essential for a comprehensive evaluation. Explanation. This scenario is professionally challenging because it requires balancing the evaluator's duty to maintain client confidentiality with the need to obtain accurate and comprehensive information for a disability evaluation. The evaluator must navigate the potential for sensitive personal information to be disclosed without explicit consent, which could violate privacy rights and erode trust. Careful judgment is required to ensure that any disclosure is both legally permissible and ethically sound, respecting the individual's autonomy. The correct approach represents best professional practice because it prioritizes obtaining explicit, informed consent from the individual before any disclosure of their personal health information. This aligns with the core principles of patient autonomy and data privacy, which are fundamental in disability evaluations. Specifically, it adheres to the regulatory framework governing the certification and evaluation of disability and impairment rating, CEDIR, by ensuring that the individual understands the purpose of the evaluation, the types of information that may be shared, with whom it may be shared, and their right to refuse or withdraw consent. This process builds trust and ensures the integrity of the evaluation. An incorrect approach that involves disclosing information without explicit consent, even if perceived as beneficial to the evaluation, represents a significant regulatory and ethical failure. This violates the principles of confidentiality and informed consent, potentially leading to legal repercussions and damage to the evaluator's professional reputation. Such an action undermines the individual's right to privacy and control over their personal information, which is a cornerstone of ethical practice in disability assessment. Another incorrect approach, such as assuming consent based on the individual's participation in the evaluation, is also a failure. Informed consent must be an active and explicit agreement, not an implied one, and requires a clear understanding of what is being consented to. The professional decision-making process for similar situations should involve a thorough understanding of the relevant CEDIR regulations and ethical guidelines concerning confidentiality and informed consent. Professionals must proactively identify potential situations where disclosure of sensitive information might be necessary. They should then engage in a clear and transparent communication process with the individual, explaining the purpose of the evaluation, the potential need for information sharing, and the safeguards in place. Obtaining written, informed consent is paramount. If there is any ambiguity or if the individual expresses reservations, the professional must respect those concerns and explore alternative approaches that do not compromise confidentiality or consent.